When people talk about KVC, especially people who've supported our mission for decades, they often talk about family. There's a KVC family that spans across many states and across time. And I think that's appropriate because KVC began as a group of families and close friends who wanted to help children. So we've always had a sense of being a community of caring. In fact, it was a group of caring women who founded KVC in 1970. Their hearts were moved by children who were victims of abuse and neglect, but had nowhere to go. That spark of compassion has grown into one of the nation's broadest continuums of care. KVC now offers everything from family strengthening programs to outpatient behavioral health care, foster care and adoption, and to the highest level of care, inpatient treatment at our children's mental health hospitals. And now, more than 50 years later, our family has grown again, not once, but several times. So let me tell you about KVC's positive impact over the last year. I also want to invite you to check out our new 2023 Impact Report at kvc.org. First, let me tell you about Camb Children's Mental Health, our subsidiary, which is the leading regional provider of children's mental health services. Camb is a network of nonprofit hospitals and residential treatment centers in Kansas City, Wichita, and Hays. At our hospitals, we serve over 4,000 youth admissions each year, helping children who are in crisis due to severe depression, anxiety, self-harm, suicidal risk, traumatic experiences, and other mental health needs. These children desperately need not only treatment, but they're also searching for hope and the kind of authentic connection that is so foundational to all of our lives. At the beginning of 2023, we held a grand opening event as Camb moved into a new location in Hays, Kansas. We completed a beautiful new $11 million building renovation so we could reestablish inpatient children's mental health services for families in western Kansas. This wouldn't have been possible without the support of Governor Laura Kelly and the Kansas Department for Aging and Disability Services, who partnered with us to bring about this new children's hospital. We're also so thankful to our three lead donors, the Patterson Family Foundation, the Schmidt Family Foundation, and the Dane G. Hansen Foundation. We held a ribbon-cutting ceremony with U.S. Senator Jerry Moran, KDAD's officials, our lead donors, and many, many other elected officials to celebrate this huge milestone. Even bigger news about Camb came this summer. In June, we announced that KVC and Children's Mercy have formed a joint venture to open a 72-bed, best-in-class inpatient mental health hospital, right across the street from our headquarters here in Olathe, Kansas. That construction is underway right now, and our target date for opening is late 2024. This joint venture is big news for Kansas City and represents a new model for transforming children's health through the power of partnership. The opportunity to combine KVC's nationally recognized inpatient mental health treatment with Children's Mercy's world-class pediatric care and research will elevate health outcomes for decades to come. Our country is facing a mental health crisis, and it's been inspiring to see so many partners step forward to help, including the Sunderland Foundation, Governor Laura Kelly, and the State of Kansas Spark Committee as lead supporters. Please check out this clip showing the leaders who helped us break ground.
There's hope. There's hope today, but today represents there's more hope coming.
This is a big day for the community, for the entire Kansas City region, the state of Kansas, and for the children and adults who have been suffering from the mental health crisis that exists.
Access to care, that's why we're here. That's the conversation. This project has been a long time coming.
Today is a great day for Olathe and a great day for Kansans.
I appreciate the opportunity to be here. I appreciate the opportunity to support the work you're doing. And thank you all so much for all the work that you are doing.
If that weren't exciting enough, KVC celebrated another significant event this year. To strengthen children's mental health, KVC and St. Louis-based nonprofit Great Circle decided to become one KVC Missouri team. This allows us to transform our collective services into a purposeful, connected system of care that serves as a safety net for children and families. Just 6 months ago, Great Circle's nearly 800 employees, along with all of its programs and services, became part of KVC. The KVC Missouri team now has more than 20 locations statewide, including St. Louis, Kansas City, Columbia, and Springfield. The team is serving nearly 9,000 people each year with family services, foster care, K-12 educational academies, residential children's mental health, and more. We're so honored to carry Great Circle's mission forward. We stand on the shoulders of pioneering children's charities like the St. Louis Orphans Asylum, established in 1832, and Kansas City's Niles Home for Children, founded in 1894 by Samuel Eason and later Frank and Emma Niles. Both are historic organizations that chose to integrate with us to form the foundation for today's KVC. There's also Boys and Girls Town of Missouri and Edgewood Children's Center. I want you to know about the men and women who started these charities, donated to them, and led them. They built incredible legacies of giving to help vulnerable children and families. And when these organizations chose to become part of KVC, they entrusted their legacy to us. And we intend to fulfill their dreams. We promise to do our part to advance well-being for all children and families so that every child we meet has a brighter future. I want to thank Lindsay Stevenson, President of KVC Missouri, for strengthening relationships with our friends statewide. In the last year, we've built positive working relationships with state leaders and legislators, new board members, donors, and volunteers, new families, and of course, our newest KVC employees. We hosted listening tours and welcome events celebrating this milestone. This is one of the single largest events in KVC history, and more importantly, it has unprecedented potential to transform children's mental health care. Children's mental health needs are on the rise, and KVC Missouri wants to be part of the solution. We're in the early stages of building philanthropic support to create a world-class children's mental health hospital in St. Louis and elevate treatment at all other locations statewide. And the news doesn't end there. We've also had highlights in our other states. Our Kentucky team is now more than 300 professionals strong and focused on safely preventing the need for foster care by strengthening families. If you want to help the most vulnerable children in Kentucky, including families impacted by the opioid epidemic or mental health needs, KVC is the nonprofit to support. In West Virginia, we received a grant from Aetna to expand into the Martinsburg area, not too far from Washington, D.C. This is allowing KVC to serve over 200 more families each year. We also recently announced a new partnership with Big Brothers Big Sisters in West Virginia to connect children in foster care with adult mentors. And in Nebraska, our team continues to grow beyond its core services of family strengthening and foster care to expand mental health care and services for individuals with intellectual and developmental disabilities. The final highlight I want to mention hits the closest to home. During all of this change, we've focused on supporting the people who make it possible, KVC employees. These are incredible professionals who are social workers, therapists, and in dozens of other frontline care positions. Our focus on both the employee experience and the customer experience is translating into something very, very special. At a time when data shows that U.S. employee engagement is declining, engagement among KVC employees is soaring. We hit a new record in the percentage of engaged employees at KVC. We also achieved a 10-year record in employee retention, with many of our local teams at over 90% annual retention. This led to KVC ranking among the top 1% of employers in the nation with a high 77 work well-being score on Indeed. This matters because it translates into better experiences for the people we serve. We also hit a new high for our customer experience score based on surveys of clients and caregivers. I could share so much more, but I'll stop with this. Thank you. We simply couldn't do this work without you. Every gift and every hour of time you give helps us strengthen families, prevent child abuse and neglect, and help both children and adults achieve mental wellness. Thank you for supporting KVC, and we invite you to stay connected because we need your help to build a world in which every child is safe and connected to a strong family and a healthy community.